Welcome. This is quiz time, and in this section, we'll be looking at questions that are related to the epithelial tissue. So write down with me as we go through this section, and at the end, we'll be evaluating our thoughts. So the first question reads that the epithelial tissue undergoes continuous mitotic division. Epithelial tissue is a collection of cells embedded in extracellular matrix. Is this what the epithelial tissue represents? The epithelial tissue is found only on surfaces. The last one is all of the above. So let's go to the second question, which reads that the following statements containing the basement membrane are correct, except that it is found on the apical surface of the epithelium? Is it except that it provides structural support for the epithelium? Or is it except that it serves as an orientation platform for the cells of the epithelium? Or is it that it acts as a mechanical barrier, preventing malignant cells from invading the deeper tissues? So which of these statements is not correct about the basement membrane? This is what this question represents. The third question reads that what type of epithelium is found at the site of gaseous exchange? Is it a simple cuboidal epithelium? Is it a pseudo-stratified columnar epithelium? Is it a stratified squamous epithelium? Or is it a simple squamous epithelium? The fourth question reads that the gap junction is involved mainly. Is it involved mainly in mechanical stability and resistance? Is it involved mainly in barrier to avoid free diffusion along cells? Is it involved in anchoring the cell to the basement membrane? Is it involved in the exchange of small molecules and ions between cells? The fifth question reads that which of the following classes does not represent the classification of epithelial tissue based on structure? Is it the transitional epithelium? Is it the squamous epithelium? Is it the cuboidal epithelium? Or is it the columnar epithelium? The sixth question reads that which of the following statements concerning pseudo-stratified columnar epithelium is correct? Is it that it has multiple layers of columnar cells? Is it that only the cells in the basal layer are attached to the basement membrane? Or is it that all the cells are attached to the basement membrane with nuclei at different levels? Or is it that the cells are constantly changing? So the seventh question reads that the stratified epithelium is the stratified epithelium found lining thin surfaces? Is stratified epithelium a single layered epithelial tissue? Is stratified epithelium constantly changing from one shape to the other? Is stratified epithelium found primarily on wear and tear surfaces? So which of these statements is correct about stratified epithelium? Now, question 8. What is the basis for classifying epithelium? Is the classification based on the types of cell organelles? Is the classification based on shapes and layers? Is the classification of epithelium based on the number of processes? Is the classification of epithelium based on the regions where they are located? The ninth question, the following statements concerning transitional epithelium are correct, except, is it except that they are usually found on thin surfaces? Is it except that they have unstable shape and size of cells? Is it that they are usually found in elastic tissues? Or is it that they are found lining the wall of the urinary bladder? The 10th question reads that tight junction. Is tight junction seen to create impermeable barrier? Is tight junction seen to allow continuous exchange of nutrients and ion between adjacent cells? Is tight junction seen to be usually located between the basal surface and the basement membrane? Is the tight junction seen to form the cytoskeletal linkages of the epithelium? The 11th question reads that microvilli found on the apical surface of epithelium, are they seen to aid movement? Are they seen to increase the surface area for more effective absorption or secretion of substances? Are those seen to be predominantly found on the wall of the alveoli, or are all options correct? The 12th question, the following epithelium lining organs are correct, except, is it except ovary lined by simple cuboidal epithelium? Is it except the alveoli lined by simple squamous epithelium? Or is it the small intestine lined by stratified squamous epithelium? Or is it the urinary bladder lined by transitional epithelium? So now we go through the answer slides to check if we are correct. So for question 1, which reads that epithelial tissue are seen to undergo continuous mitotic division. This option here is the correct option. Epithelium is not a collection of cells embedded in extracellular matrix. This is what the connective tissue represents, and they are not only seen on surfaces, they are also seen to line the interior walls of organs. The correct option here is that the epithelial tissue are seen to undergo continuous mitotic division. So the second question, the following statements concerning the basement membrane are correct, except the fact that they are found on apical surface of epithelium. The basement membrane is seen on the basal surface of the epithelium and not on the apical surface. The third question, what type of epithelium is found at the site of gaseous exchange? The specific type of epithelium that you see around this region is a simple squamous epithelium. This is the tiniest form of epithelium lining, and this is what is needed at the site where gaseous exchange would occur. Because we do not need any form of padding at this site, it has to be thin so as to facilitate the exchange of gas at this point. And the specific type of epithelium that is designed for this kind of function is a simple squamous epithelium, which is a single layer of flat cell. So for question 4, gap junction is involved mainly in the exchange of small molecules and ions between cells. This is what gap junction allows. The 5th question, the following classes does not represent the classification of epithelium based on structure. The answer is the transitional epithelium. The transitional epithelium are constantly changing from one form to another. They do not have distinct shape that they represent because they are constantly changing to suit the capacity of the organs that they are lining. So when you compare it with the other epithelium, which include the squamous, the cuboidal, and also the columnar, these are epithelium that represent distinct shape, while the transitional is not seen to present any distinct shape. It is seen to be constantly changing from one form to the other, depending on the degree of expansion of the tissue that they are lining. The 6th question, which of the following statements concerning pseudocolumnar epithelium is correct? The correct option here is that all the cells are attached to the basement membrane with the nuclei at different levels. We say it is a pseudo-stratified columnar type of epithelium. So it gives a false representation of a stratified epithelium. Meanwhile, it is a single layered epithelium. So you have all the cells attached to the basement membrane. The only distinct presentation that you see is that the nuclei are not on the same level. They are at different level. And this is the correct option here. So the 7th question, stratified epithelium is primarily found on wear and tear surfaces. These are the specific regions where you see stratified epithelium. Because they are stratified, they are in layers. So regions that exhibit wear and tear processes, they are seen to be lined by stratified type of epithelium. So that when these processes occur, they can be easily replaced because of the stratification. So for question 8, what is the basis for classifying epithelium? The basis for classifying epithelium is based on their shapes and also the number of layers that they represent. This is how epithelium are classified, depending on the shapes that they take and also their number of layers. The 9th question, the following statements concerning transitional epithelium are correct, except the fact that they are usually found on thin surfaces. Transitional epithelium are not seen on thin surfaces. What we see on thin surfaces are simple squamous epithelium because they act to be thin, and the tiniest form of epithelium that represents this configuration is a single layer of flat cell, and this is what is seen to line thin surfaces. But for transitional epithelium, you have all the other options correct about them, except that they are usually found on thin surfaces. The 10th question, tight junction. Tight junction creates impermeable barrier, and this is why they are tight. So they do not allow free movement of molecules and ions at will. They help to control the movement of molecules and ions across the epithelial lining. So this is why they are so named tight junction. The 11th question, microvilli found on the apical surface of epithelium are seen to help increase the surface area for more effective absorption or secretion of substances. If you see the microvilli are infoldings of the apical surface, and if these infoldings are seen, it means that there's going to be an increase in the surface area for the processes that the cells exhibit. The 12th question, which is the last question, the following epithelium lining organs are correct, except that the small intestine is lined with a stratified squamous epithelium. The small intestine is lined with a simple columnar epithelium and not stratified squamous epithelium. So it's good that we know the specific type of epithelium lining specific organs. So thanks for watching this video, and let's know what your grades are in the comment section.